Hello, nurses. This is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing and the NCLEX. And this is cardiac lecture number 22, CAD and the overview of labs to pave the way to an MI. And I'm covering this sticky note found on nursingkamp.com, Pinterest, Instagram, and Facebook, and also nursingkamp.com. Okay, let's get going. So when we're talking about this cardiac fishbone, we're talking about cardiac labs. And cardiac labs are specific to cardiovascular disease, or CAD. In my previous lecture, I talked about CAD as a blanket statement of atherosclerosis or arterial sclerosis. And when you just get a question on CAD, it's a generic question. However, arteriosclerosis and atherosclerosis is more acute because it's more specific about what's really going on with the underlying vessels. And we talked about atherosclerosis being at the wall of the coronary arteries, so the problems there, and there's rupture, plaques, and problems. And then arteriosclerosis, which is more about the stretch and angina, and it can't meet the demands. So, but we're talking about labs right now, and the first thing we're going to look at is the Ascent Rate. Now, the Ascent Rate is for inflammation. In the previous lecture, I talked about blood and red blood cells being down here. What Ascent Rate does is it basically spins it in centrifuge, and it spins around, and those red blood cells fall to the bottom, and that's called Ascent Rate. All right, well, it's a good indicator for inflammation. So that range is 10 to 20 on males and 10 to 30 on females. But more important for what we're going to talk about is the C-reactive protein rate, or the CRP. And that, I always think of CRP3. And needs to be less than 3. If it is greater than 3, they're at risk for inflammation, more specific cardiac inflammation. And when we talked about previously with cardiovascular disease, the first signs are calcium deposits. Also, the CRP is also a chronic lab that says that, hey, listen, your vessels, your coronary artery vessels are inflamed. Not really, but pretty much it says that there's inflammation going on. And that's one of the first prime signs that cholesterols can start to bind to these areas. And that could be the cause from hypertension, diabetes, high cholesterol, hyperlipidemia, and family history. All right, so it's important to know on the CRP that is cardiac specific, and let's get into the fishbone. So the fishbone for this looks like this, and on this side is going to be our cholesterols, and the first cholesterol we're going to look at is 200, and that is total cholesterol. And total cholesterol is a generic screening that they might get at a blood pressure clinic where they do biometrics. And they do a little finger stick and they get a cholesterol and it's greater than 200. Well, that could be either acute or chronic. So we don't really know which one it is. So what we need to do is get a fasting lipid panel, and that's these. So they go down here. And these fasting lipids are, what is really going on? What's making it greater than 200? If it's less than 200 on a total cholesterol, that's good. You're good to go. You don't need a fasting lipid. But if it's greater than, you need a fasting lipid. So the next step would be get a fasting lipid. Don't start them on meds right away. Let's do a fasting lipid. So the next thing is triglycerides. That is also 200. We want that less than 200. Now these numbers are kind of all over the place when you're studying and stuff, but this is the general idea with NCLEX. NCLEX generally will focus on, understanding this concept. So 200 is, you want that less than 200. Then we drop it down to 150. And then we want this LDL, which is the lousy cholesterol. We talked about that in a previous lecture. That's the bad cholesterol. And we want that LDL, we want that low, and less than 150. Then the other one is we grab this 50 and we bring that down, and we have the HDL. And HDL is the happy cholesterol. That's the good cholesterol. And that's one that we said before, that when LDLs bind to the sides of the arteries, the HDLs are ones that come around and clean it up and get rid of it. And we want to raise that. It's very difficult to raise that. You can do it with sometimes medication, but you can't really do that with diet. It's kind of how your liver functions and how it makes cholesterol. So family history is very important. So choose your parents wisely. The next thing is, so we have a cardiac diagram on total cholesterol. So the other one is your CRP. And your CRP, 3. And we want this less than 3 because that shows that there's inflammation. We'll talk a little bit more about the other labs that are on this side, but we're just going to go over them really quickly, like troponin, myoglobin, and then CK total, and then your BNP, which is for CHF. And we'll cover that in the next lecture when we cover those topics of MI and CHF. So let's go over the overview. So generally when we're talking about cardiac labs on a chronic level on CAD, the first thing what we'll do is that we might do a CRP. And a CRP is to evaluate inflammation, more cardiac. And we want that less than 3. They might also get a total cholesterol, which might be greater than 200. It doesn't mean they have hyperlipidemia. They need to be further evaluated because they might go and all of a sudden this fasting lipid looks perfect. And it was the HDLs that were increasing at greater than 200. So don't think that they have cholesterol just because of a total cholesterol. So that's chronic. Next one is a fasting lipid. Now the fasting lipid profile will be evaluating the really what's going on as far as the body. And triglycerides need to be 200, less than 200. LDLs need to be less than 150, and HDLs need to be greater than 50. Now this is actually a little bit different because females are greater than 40, males are greater than 50. But NCLEX doesn't really get into splitting hairs about the numbers on cholesterol. It's more understanding LDLs versus LDLs, CRP, and total cholesterol. All right, that's about it. My name is Camp, and this is Nursing Camp. This is cardiac lecture number 22, CAD overview, where you can find me on Instagram, Facebook, Pinterest, and Etsy, and Twitter as well, nursingkamp.com. I'm covering this fishbone right here, where I'll cover the other things when we get to more comorbidities like MI and CHF. That's it. Now nurse on, and we'll see you next time.